Every night while you sleep, your brain is doing something incredible. It's cleaning itself. The glymphatic system acts like a waste disposal crew, flushing out toxins and proteins that build up during the day. I'm Dr. Tammy Penhollow, a spine and joint expert at Precision Regenerative Medicine, and today we're diving into the groundbreaking research that reveals how the system works, why it matters for conditions like Alzheimer's, and what you can do to keep your brain healthy for the long run. Let's dive in. So the glymphatic system is a kind of take on the lymphatic system and the glial cells, which are kind of those little foot soldiers of the brain and spinal cord, which we've talked about before. It has been identified since 2012, but it was confirmed, and new recent MRI imaging has updated our information on this. So that's what we're going to talk about. What the glymphatic system does is it uses our cerebrospinal fluid, CSF, to flush waste through the perivascular system. We've got little blood vessels in our brain, and it goes through these spaces and acts like the brain's version of the lymphatic system. There was a new study at Oregon Health Sciences University and the VA of Seattle that confirmed these definitive visualization in humans. Up to date, it was just on, or to this point, it was previously on animal studies, but it used contrast MRI. These patients already had little tubes in their brain for tracking of their cerebrospinal fluid and trying to manage the pressure within the brain, but they received a gadolinium tracer, which showed that the fluid traveled along structured paths, not just in this random diffusion. So very specifically along these pathways so that it could kind of go along its little route and clean things up. So this was proof that the glymphatic system exists in humans, not just animals. Why does this matter? Why do you care? Because as the glymphatic system is working every night, it clears amyloid beta, tau, and alpha-synuclein. These are key proteins in Alzheimer's, Parkinson's, and dementia. The impairment of this system is linked to obstructive sleep apnea, traumatic brain injury, stroke, multiple sclerosis, migraines, brain tumors, and more. That's why it matters. And sleep dysfunction, sleep disorders may not just be a symptom, but driver of neurodegeneration. How's this work? It's driven by pulsations of the arterial system and astrocytes in feet. And these waste drains into then the meningeal, the cervical lymphatics, and the arachnoid granulations. Some argue that clearance doesn't depend on sleep, and we've disputed that with this most recent study. It talks about glymphatic clearance being imperative or definitely depending upon the sleep. So clinical implications are poor sleep, higher dementia risk. Obstructive sleep apnea is a modifiable risk factor for Alzheimer's and Parkinson's. So if you have OSA, first of all, get it diagnosed. Second of all, treat it. I know it may not feel awesome to wear that obstructive sleep apnea CPAP machine. You can also talk with the person who has prescribed it for you and try something different. There are so many different sizes of masks and different fits. Some people qualify for the nasal pillow. Some people qualify for an oral appliance that goes in and kind of moves that jaw forward, helps bring the tongue out of the way, helps keep the airway open. Just keep trying because it's so important to treat this. In the future, we may be able to get blood tests, imaging scans, or maybe even a wearable head cap that can measure the glymphatic health. There's also a potential for drugs or devices to enhance clearance of the lymphatics. But right now, what we have is get good sleep, excellent sleep hygiene. You can prioritize quality sleep, which we've talked about before. You set your phone to go on to a do not disturb a couple hours before bed, so that therefore you're not on this thing getting all that blue light. You are not answering text messages. You're not scrolling your reels. You are in kind of calm down mode, quiet time mode, and you can minimize the amount of other things that you do in bed. Bed is for sleeping. And one other thing, it is not for watching TV. It is not for reading. It is not for scrolling on your phone. These are good sleep hygiene techniques. Also, you can improve your cardiovascular health through workouts. That supports pulsatility. That also promotes good sleep architecture. So all of these things are super important in addition to treating sleep apnea if you've been diagnosed. In conclusion, the glymphatic system is one of the most exciting discoveries in brain health. Sleep isn't just rest, it's repair, it's detox. And taking care of sleep today could protect your brain for decades. If you like what you've heard, please like, subscribe, and send this to somebody who you think could use it. Thank you.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.